I'm Dr. Michael Weaver. I'm an addiction medicine physician at the University of Texas Health Science Center at Houston. This mini video summarizes the most essential lessons from our course on reducing alcohol-related mortality and morbidity. In medical practice, you will see patients with risky drinking. We know that alcohol use disorders can lead to serious medical, psychiatric, and social consequences, and these tips in this video can help to better care for our patients. We know that alcohol causes cancer throughout the gastrointestinal tract as well as the breast and other sites in the body. Reducing alcohol consumption leads to measurable health benefits on blood pressure, liver transaminases, and the risk for stroke or angina, as well as improvement in quality of life. Although complete abstinence has the best outcomes, patients can still achieve significant improvements in health when drinking is reduced to no more than 2 standard drinks per day for men and no more than 1 standard drink per day for women. It's important to screen for problematic alcohol use. There are several screening tools that are readily available for this purpose. One of the simplest and easiest to use is the single item question from the National Institute on Alcohol Abuse and Alcoholism, or NIAAA. This asks, how many times in the past year have you had a certain number of drinks in one day, with differences for men or women, as you can see here? A positive screen is 1 or more episodes of this level of drinking. Another good screening tool is the Alcohol Use Disorders Identification Test, or audit. This one's a little longer and has 10 questions scored from 0 to 4 points, and a positive screen is 8 or more points. There are also separate screening tools that are geared towards adolescent patient populations. Another one from the National Institute on Alcohol Abuse and Alcoholism is the NIAAA Youth Guide. This has 2 questions, and it is for ages 9 to 18 years old. Another screening tool is the S2BI, which stands for Screening to Brief Intervention. A positive screen is use of any alcohol in the past year, although this screening tool asks about more than just alcohol. It also includes tobacco and prescription medications. If the frequency of alcohol consumption is weekly or more frequently, then that is considered high risk and is a positive screen. Another screening tool for adolescents is the CRAFT, C-R-A-F-F-T. Each of the letters in the mnemonic stands for a key word in a question to ask about alcohol-related behaviors that are more germane to adolescence. A positive response to 2 or more questions is considered high risk and a positive screen. With adolescents, I recommend to screen confidentially. So I will talk with the adolescent without his or her parents present first, after gaining the parents' permission, and then bring in the parents and have a broader discussion about the drinking and other issues. Motivational interviewing is the heart of effective communication, and it can help to motivate patients to make changes in their drinking behavior in order to become healthier. A good way to remember some of the principles of motivational interviewing is with the OARS framework, asking open-ended questions, affirmations, using reflective listening, and providing summaries. Motivational interviewing is part of brief intervention, and brief intervention is part of the SBIRT paradigm, which stands for Screening, Brief Intervention, and Referral to Treatment. The brief intervention elements can be remembered with a mnemonic known as FRAMES. This includes feedback, responsibility, advice in the form of a menu, empathy, and self-efficacy. These techniques will not only help build trust with patients, but also empower patients to identify their own reasons for reducing their drinking behavior. There are a variety of practical harm reduction strategies available to help reduce alcohol consumption. Eating food before drinking can be an effective strategy to reduce the amount of alcohol consumed, as well as how quickly alcohol is consumed. And this can reduce intoxication as well as reduce harms related to that drinking episode. Drinking non-alcoholic beverages in between alcohol drinks is another way to help reduce overall drinking as well as how fast someone is drinking. It's best to use beverages that don't contain a lot of sugar because sugary beverages can be dehydrating and that can lead to more hangover symptoms afterwards. So actually avoiding sugary beverages can be a form of harm reduction. There are a variety of technological tools that are available to help people with tracking drinking, including smartphone apps and even wearable devices. These can assist patients with learning about how much they drink, tracking how much they're drinking on an ongoing basis, and in some cases, even warning patients about preset drinking limits. Another good form of harm reduction is making arrangements for a safe ride home after an episode of drinking. This can be done by arranging with friends or family members or by using a ride-sharing app. In terms of accountability, household members and friends can be enlisted to aid the patient in achieving their goals to reduce drinking with education and gentle reminders. All of these are effective forms of harm reduction that can help patients who are not ready to abstain from drinking alcohol. And as we have learned, cutting down even to smaller amounts of alcohol can have significant health benefits. For patients that have more serious problems related to drinking, more intensive strategies can be offered. This can include medications to help with reduction in drinking. FDA-approved medications include naltrexone, acamprosate, and disulfiram. Naltrexone and acamprosate are first-line medications, and disulfiram is considered second-line because it doesn't help with cravings for alcohol, but provides a negative reaction if even a small amount of alcohol is consumed. For my patients, I will often combine naltrexone or acamprosate if I am prescribing disulfiram so that they have benefits from reduction in cravings as well as the negative effects of taking disulfiram. There are also evidence-based behavioral treatments that are delivered by licensed therapists, and these can be an effective component for patients that have more serious problems related to drinking, and patients can be referred to any of a variety of these behavioral therapists. Mutual support groups are also available in the community and can be a valuable option for providing support to patients related to education about drinking and help with reduction in drinking. There are also online options for these groups nowadays. These include Alcoholics Anonymous and other 12-step based groups, as well as Smart Recovery, which stands for Self-Management and Recovery Training. These groups don't cost anything and are easy to access and can be a valuable resource for patients in terms of support. All of these strategies can help reduce alcohol-related harm and improve patient outcomes. I recommend that you apply at least one of these concepts in your next patient encounter.